Jim Wakeford has AIDS and says that pot helps him control the pain. Not only does he want the federal government to let him use pot, he wants them to supply his stash. Tonight on Jane Hawtin Live, medicinal marijuana.
Stand by, Canada. Now you can talk to the newsmakers and have your say. This is Jane Hawtin Live.
Hello, I'm Jane Hawtin. Last month, a Decima survey found that 78% of Canadians are in favor of allowing pot to be used for medicinal purposes. But some wonder how committed the government is to that idea. Jim Wakeford is a social activist who has full-blown AIDS, and today he put the government's feet to the fire. He is suing the government civilly, and today the government of Canada was forced to appear in court to have an official testify as to what plans the Ministry of Health has to assist sick people who need marijuana as medicine. Jim and his lawyer, Alan Young, join us directly from their day in court. Thanks for joining us.
Wow, thanks for having us.
So how'd it go?
Oh, shit, I don't know. Like he said he'd get back to me. They all
So the judge
say
will
that.
make a decision, right?
He's a wonderful judge, and he's trying to be fair, and I believe he is a very fair man.
Right.
But you can't read him, and I don't trust anybody now, because I've been trying to get the right to this medicine since 1996 when I began to waste. And I've needed it critically every day since, and I have committed civil disobedience since 1996.
Which means that you've smoked marijuana
Daily.
illegally.
Daily.
And how does it help you? What does it do for you?
When I was on the AIDS drugs that nearly killed me last March, the particular form of chemotherapy that I was on, it caused such severe wasting. I dropped to 116 pounds.
Wow.
A colonoscopy was performed to check for any nasties inside me. And a Hickman line was installed in my chest, and I was fed intravenously for 2 months. And prior to that,
So you lost a lot of weight because
yes,
of the drugs and
the
because of
drugs
what you were
nearly
going
killed
through.
me.
Right.
So, prior to that, I tried a drug called Marinol when the wasting was occurring in 1996.
Which is a synthetic form
Right,
of cannabis.
of marijuana.
Yes.
It's the pharmaceuticals answer. They think, anyway, it was a very difficult pill for me because it caused 7 hours of further waves of nausea and vomiting. So
That's
I
not what you
refused.
wanted.
Well, I couldn't do that
Right.
to my body.
So what happens when you smoke
So
marijuana?
fortunately, friends reminded me about marijuana, and it induces appetite, it stimulates appetite, but it also helped me tolerate those AIDS drugs before they nearly
Right.
whacked me out.
To tolerate the nausea.
Yeah,
to make
the
it
side
easier for you.
effects. Like I had to take Crixivan at 4 on an empty stomach, DDI at 5 on an empty stomach. I know they sound like pesticides, and they are toxins.
Right.
And they do extend lives, but at great price. And marijuana is the medicine that is useful, helpful in my struggle to stay alive.
Right.
And I want to live because I've got a lot of things to do.
Right
Maybe we'll
on.
talk about them.
Absolutely. But I mean, Alan, the points that Jim's making are a good ones. I mean, we know
We know
that
this. The
marijuana.
government knows
that
this.
marijuana
Everybody
works.
knows this. The problem is the government in 1923 made this a prohibited substance, and they don't know what to do today. Jim is suffering immensely. They've made promises that they're going to take care of sick people. We took them to court. The judge said, I'm not going to act because the government can act under Section 56 of their legislation. So we applied. I always said it's an illusion. After
Right.
6 months of waiting, we went back to court to prove it's an illusion, and I think we did.
Now, but tell us first what Section 56
Section
is and what it's
56
supposed
allows
to do.
Alan Rock to exempt anyone from the operation of our drug law.
Right.
They could designate you to be a drug trafficker tomorrow if they wanted to. What we've applied for is for Jim to be exempt from the law so he can possess and cultivate marijuana. I know that they have no serious intent. And I argued that first time. The judge said, well, it's on the books. I
It's
have
on the
to
book. It
accept
says that he can do that,
So
and
we
you
applied.
have to at least apply to do that.
So we applied.
So you tried.
And we waited and we waited. I sent more letters, and
September
they just
14th.
kept avoiding the issue. And it's 6 months now, and they still haven't done anything. So we went back to court. The government was required to bring one of their spokespeople up. And I think we demonstrated that they're in complete disarray. And the problem is this is about immediate medical need. You can't say in a couple years we'll figure out the issue. Jim needs help today. So the judge has gone back and will consider over the weekend whether to leave it in the government's hands or to intervene and give Jim the relief that he wants.
But it's already been something of a victory. I mean, for the
And
courts to order
and
the
I
government to come and answer for themselves.
Beyond that, through Jim's case and some other cases, we've exposed the hypocrisy in the government, and we've also exposed the importance of this issue for various different illnesses, and I don't know why. Marijuana seems to be the most effective medicine. And I think the Canadian government has an obligation to take care of sick Canadians. And we've exposed this issue, and that's why you can say 78% of Canadians support it because of people like Jim.
Right. But the issue is that, I mean, if it was heroin or if it was cocaine,
I
that
was
you wanted.
told by, see, I didn't start off with a lawsuit.
Right.
I initiated this process in 1997, I think it was 6 or 7. After the bad marijuana experience and after finding marijuana helpful, I then participated with a group and made an application to the Human Rights Commission and was told politely to go elsewhere.
Right.
I then participated actively with a community leader to establish the first buyers club in Toronto called Cannabis as Legitimate Medicine, CALM. We were only able to keep it open a few months, and I realized that the only way I was going to get this, see, I had written a letter to the Prime Minister, the Justice Minister, and the Health Minister in July 1997. I was very naive. I was sick, and I thought, I'll write to these people. They can make things happen, and surely they're compassionate, and they'll help me.
Did they write you back?
The Health Minister said I could have heroin or cocaine if I met certain criteria, as could you. I couldn't have marijuana because it was an illicit substance. I've been jerked around by politicians at that level for all this time.
Yeah.
And so I'm, as much as possible, speaking out publicly about their intransigence and their reluctance to assist us. You know, what was revealed in court that I found most offensive today was the fact that the first place these officials that are examining my extraordinary request went to visit.
Extraordinary request is from the letter from the government.
Yes,
right?
yes.
November 18th, when Alan Rock blew me off the airwaves and shut me down for a few months while he had his officials examine my request. They went off to Washington to meet with the drug enforcement people there and the National Institute of Drug Abuse. I'm a Canadian. Canada produces some of the best marijuana in North America.
The problem is there's
They're running off
paralysis
to
in the
the
government
States.
right now because of two things. One, we're afraid of our American neighbors because the DEA does not want us to do this. Secondly, there's no money right now in marijuana because it's a naturally occurring substance. That's why you can get heroin and cocaine, because someone's going to benefit, a pharmaceutical company that produces it. But marijuana can be grown in someone's backyard. So that's why the government isn't moving with great dispatch, because they don't have the motivation to economically, and they are very afraid of the Americans. Because we'll be the last.
Do you think that's still an issue, though? I mean, because I mean,
Yes.
okay.
You know,
I mean, they do seem to be
Nancy's
back.
words prevail.
Well, I
just
know,
say
but
no.
Nancy's not there anymore. I mean,
Doesn't
they seem to
matter.
be
Her
backing
her
away from
legacy
the
will
no means
continue.
no stuff.
No. There are more arrests for marijuana in Bill Clinton's regime than under the Reagan regime. They're at the highest rate in 1997. It's still a very big struggle. And I'm not sure if you're aware of this, but a lot of Canadians were having trouble getting across the border because American customs were starting to say, have you ever smoked marijuana your entire life?
Yeah.
And you say yes, you can't come to the United States.
We've done
and that's
stories
what the
about it.
Canadians are afraid of. The government is there'll be trade sanctions and other forms of sanctions if there's access to marijuana. In the same way, when Holland decriminalized, the Germans were very negative towards
But
the
how
Dutch.
could they do that if it was medicinal marijuana? I mean, surely there's a way that you could set this up, right? Isn't there?
No.
Why isn't there a way
think
that you could
it's
do
the
this? to make it
floodgates.
legal?
They think if Jim can smoke marijuana so he doesn't throw up, that will be the floodgates opening for all the kids of Canada to sit and smoke marijuana. That's not the issue. This is about medicine. This is not about recreational use. But the government can't draw that distinction in their minds. And
Well, they won't.
They won't,
could
yes.
if they had the will.
And that's what the Americans have done. Because in the United States, 7 states have opened the doors to medicinal marijuana. And Bill Clinton, the federal government, said, we're not going to respect that. Sure, state laws change, but federal law still applies. And there's a huge battle right now in California between the physicians who want to prescribe marijuana and Bill Clinton saying, we're going to prosecute you.
But why go through this? I mean, let's face it, you don't have to wage this fight. I mean, it's not that difficult to get marijuana. I mean, you could just continue smoking
Yes,
it illegal.
Is. No, Jane, because the problem is, I can't tell you how many hundreds of dollars I've lost through being ripped off on the streets. I have no idea the quality of the marijuana that's available on the streets and illicitly. I don't know many growers personally that can coach me and teach me how to grow it myself when I'm well enough. Those are the problems. And it's expensive.
And
it's
another thing-
$300 a month. I believe it's medicinal and should be medicine, and I believe it should be covered under every provincial drug plan in this country.
Would heroin or cocaine be covered?
That I'm not sure, because it's usually just distributed to hospitals as
Right.
painkillers, so I'm not sure. But Jim stands in risk of being charged and
Every day.
prosecuted. Just because he tells a police officer, I'm an AIDS patient, I need it for medicine, doesn't mean they're not going to proceed. And I represent a number of people right now who have told the authorities, I'm a medical user, and they're still proceeding. That's why Jim is fighting this, because he doesn't want to live with that fear and anxiety, and he doesn't want his friends to.
Yeah.
Right.
There are other reasons. I have sued the government for safe, meaning free of criminal sanction for me and my caregivers, clean, free of contaminants,
Yep.
affordable marijuana for medical purposes. And I have added a fourth category
Okay.
in view of my experience with the government, high quality. Because if it isn't going to be helpful, I now know, I've been using it, as I say, committing civil disobedience since 1996. I consider myself an experienced medical marijuana user, and I should be allowed to do so without fear of harassment. The government have already, well, anyway, two of my caregivers, two of the people who helped me when I was at my sickest at home, have been taken down by the cops in the last few months.
They've been arrested?
Yes, they sent 5 to take down the first one. I call them goons or thugs. These are people under some guy named Rick who runs the Metro Narcs. Rick Chase.
I'm sure he'll appreciate
I've been waiting for
I
Rick
wish you hadn't
Chase
remembered his last name.
to visit me.
No, he's made public statements in this regard. It's not a problem.
I am a very honest and open man, and I have not withheld any of my activities from the authorities from day one. And I resent that they're injuring and hurting my friends and other sick Canadians. I resent it. But the point I wanted to make was, I've added, or did I already make it, about the high quality.
High quality, we already made that point.
'Cause I don't
We'll take a break. We
trust
want to
them
hear
all.
from you. We want to know whether you support Jim in this battle. The phone lines are open at 1-800-510-JANE, or you can email us at jane@electric-tv.com. Should we legalize medicinal marijuana?
Our phone lines are now open. Jane at 1-800-510-JANE.
Yeah, I think it should be legalized. I think kind of our view on marijuana is old and outdated, and really it's something that should be considered, I mean, for medicinal purposes.
Because it seems to work. There are so many people saying that it's a good thing, so yeah, sure, why not?
I think if something can be used for medicinal purposes and it can be regulated properly, then there's no reason why that medicine or drug shouldn't be used for the good service it can provide to a patient.
Like, doctors should be able to use it. If it is one of the tools to cure people, then that's fine. But if just the accessibility would be a problem.
Absolutely. I had family members who had cancer, and I know it relieves pain and gets rid of some of the nausea to do with chemotherapy, so absolutely.
Tonight we're asking if we should legalize marijuana for medicinal use, and if we do, who should pay for the pot? Our guests are Jim Wakeford, an AIDS patient who is suing the government for the right to use pot, and Alan Young, who is his lawyer. Let's go to the phone lines and talk to Christoph, who's calling from London. Hi, Christoph.
Hello.
Hi, what do you think about this?
Well, in answer to the question, I do believe it should be legalized, but I'm listening to the debate that's going on. I'm finding it amazing that the doctors aren't actually speaking up for the patients themselves. I mean, the immune system is being attacked by the remedies, so it's fascinating that they don't use something like marijuana in order to relieve the pain, but not attack the immune system itself.
Well, there are some doctors.
There are, but doctors are generally very cowardly on this issue, and one of the reasons is because the medical associations don't.
They're not cowardly?
They're not allowed.
Well,
by law.
No, but by law they can. But the medical associations don't approve of it. They can prescribe anything. You just can't fill the prescription, and they don't want to engage in this battle. Unfortunately, in the United States, physicians seem to be a bit more courageous. But in Canada, with the exception of Jim's physician and a few,
it's a handful.
Have a lot of trouble getting expert witnesses to come to these trials.
Is that right? They won't come forward? Why? Because they're afraid.
Because they feel they'll be stigmatized, and the conventional
medicine. How unfair
medicine.
is that? They know.
They know, but they do believe that conventional medicines work as well. And everyone knows pharmaceutical companies and doctors are in bed together. And I don't mean any disrespect that way, but they both profit off each other's activities, and they prefer to write a prescription for a synthetic than tell someone, oh, just go in your backyard and grow marijuana, because nobody profits from that.
I also know, though, many doctors who do speak out, and certainly many of the HIV primary care physicians in Toronto have.
Yes.
I think one could fault perhaps physicians in other fields where patients benefit, cancer in particular, MS, oncologists. The HIV physicians that I've met are already working under such enormous, stressful situations. I think people get bored with marijuana, frankly. There are far more pressing problems we're dealing with.
But on the other hand, when it's so accepted, I think people also get bored with, well, why aren't we just doing it? Why aren't you just legalizing it for medicinal purposes? I mean, there really doesn't seem to be much debate over that issue
and that's why it's a national disgrace, because it shows the failure of our electorate. The Canadians are speaking, the government isn't acting, and they're spending $1 billion a year on the whole cannabis issue. And I think Canadians should be upset that their tax dollars are being wasted and their voices aren't being heard.
Okay, let's talk to Sherry in BC. Hi, Sherry.
Hello.
Hi.
First of all, I just want to say to Jim that I'm very proud of him and what he's doing, and that I myself have been, I have Crohn's disease, and I use medical marijuana, and I recently have actually been arrested for growing it, and I'll be going to court this month, but I just want to say it should be legalized. I mean, I've used it for a few years now, and I really think it should be, and I'm just glad that Jim's there and doing this for the people. And hopefully, in my case, I would like to, hopefully it comes out in court that is for medical use, and hopefully it gets in the paper. And sorry, I'm kind of nervous.
That's okay, Sherry. I guess that's pretty tough, though. I mean, that this is something that you're growing for your own use?
Yeah.
You weren't caught as a dealer or something like that?
No, although I was charged with that, I guess, because I had a certain amount, but it's not easy to grow when you don't know what you're doing, so it takes a while to,
Well, Sherry,
if
it's any consolation, you do have to face an ordeal, but I will tell you that in British Columbia they do have the most liberal policies, and they do tend to pull 53% of their cannabis charges, so you may be fortunate enough to have your charge withdrawn if you weren't growing too much, and I hope that happens for you.
Well, thank you.
And thank you for your good wishes, but nonetheless, if you can possibly do it, get a good lawyer. If you haven't got money yourself, try and get some friends to get you some. Don't trust anybody. that is still a criminal offense, and it can affect your mobility and God knows what else. So I wish you well, and get a lawyer.
Well, and I guess this is the tricky part, because most people think that because it is accepted and you've got 78% of Canadians saying it's not a problem, that no one's getting charged. But you're very concerned about that. And the woman that we had on the show, Lynn Ricci.
Yes, she's being charged, and I can't get the charge withdrawn, and all she did was smoke one joint on the steps of the London police station to make a political statement.
Right.
I'm getting on average 2 to 3 calls a week from medical users who have been charged. Now, I mean, some of it's frivolous. I get people come, oh, I stubbed my toe and I smoked marijuana. But many of them are very serious ailments, and I call Crown attorneys for them. I can't take on every case. I don't have the time. And I call and say, there's medical use here. There's a letter from a doctor. Will you withdraw the charge? And especially in smaller communities, it doesn't happen.
Why?
I don't know. It's news to me. I would have thought they would exercise their discretion not to penalize medical users upon proof that it's legitimate medical use. But discretion is only as good as the person exercising it, and apparently there's some people not exercising it very well.
And so then it becomes stressful. It also becomes financial.
Yes.
Because of the cost involved in going to court.
I don't want to overstate it, but it can destroy your life. But anytime you're charged with a criminal offense, it has that potential.
Yes, and this is not a new problem. 20-some years ago, I served on the York County Legal Aid Area Committee. We reviewed appeals from the director's office, and I was a community member who served as a volunteer to review these appeals. And I was there in part because I knew what was happening to the kids on the streets in those days. They were being charged helter-skelter, right, left, center, and everybody just laughed as though it was something silly and frivolous. Many of these kids ended up with criminal records that have haunted them for years. Yeah. It's insane.
Let's talk to Liz, who's calling from Whitby. Hi, Liz.
How you doing?
Good, thank you. Do you support Jim and what he's doing here?
Absolutely. And Jim, I wish you all the best. You're a wonderful, wonderful guy. My question is, I guess, the logical thinking from the medical community, because if marijuana was called whiskey, there'd be a whole different thing. It's legal. I think the perception is that, oh, marijuana, therefore Jim's going to be a heroin addict soon, and he's going to break into someone's house to support his habit. And, you know, he's going to go crazy, which is so backwards and insane. And
well, that's the gateway drug argument, though, that there are still a few people who will make.
Well, which maybe your grandma, but certainly not anybody in this day and age. And the other thing, absolutely, if there's any way it could be on a health plan, you shouldn't be criminalized. If it helps anybody who has AIDS, who has MS, cancer, whatever, then, and they've tried everything else, if you have something that works for you, then why wouldn't the medical community approve of something that works, rather than a drug that's going to make you very ill and on top of your current illness?
If I can just speak to the health plan issue, because a lot of people balk about the idea of the government paying for it. Marijuana is expensive for one reason. It's a black market substance. It's called a crime tariff. People will charge a lot of money because of the risk of apprehension. And so people like Jim have to pay exorbitant amounts because of the government policy. So our position is, you take care of it, because you're the one costing Jim this exorbitant amount. If you would take care of it and legalize it or run your own operation, you could reduce the cost. It's very cheap to grow this. It doesn't take a genius to grow marijuana.
Somebody told me, this is not original, but that it can be grown after the startup costs for a grow space are taken into account for a price of a pound of tomatoes.
Right.
I don't know what a pound of marijuana costs, but an ounce is $300.
But you still have the risk because it's illegal. Let's talk to Kami, who's calling from Vancouver. Hi, Kami.
Yes, hi.
Hi.
I was calling because I think it's quite hypocritical that substances like heroin and cocaine are legal for medical use, and yet marijuana is not. And I know that in order to be in this category of the most criminal substance, it has to be proven that this substance has no medical use. And to me, that's kind of crazy, because recently the Institute of Medicine has released a study where they've examined all the other studies done on marijuana, comparing it to other substances, looking how it does with Marinol, and they found out that, you know what, sure enough, there are tons of medical uses for this substance. So what I don't understand is now how come we are not allowed access on further medical use?
Health Canada and the DEA both take the position that there is no accepted medical use for marijuana because there are no clinical studies to demonstrate it, and there are no clinical studies because the governments have never funded the clinical studies. And that's the catch-22 we find ourselves in. The Institute of Medicine did suggest it has great medicinal value, but they were talking about synthetic cannabinoids. It's an American institution. They don't want to say marijuana is effective. They say the synthetic counterparts are, but if the synthetic counterparts are effective, we know the plant is. It doesn't take a lot of thinking to reach that conclusion.
Let's talk to Danielle, who's calling from Halifax. Hi, Danielle.
Hi.
Hi.
How are you?
Good, thank you. Do you support Jim?
Yes, I do. Actually, hi, Jim. How are you?
Hi.
Are you feeling better?
A little. I'm scared right now because I have to go back on chemotherapy.
Do you? Because my brother has passed away in 1992 of AIDS, and so he was 38 years old. And when he died, he weighed 68 pounds. And it was just dreadful, and I think that the medicines, and he had said all of the time before he had 2 children, and he had said that you know, we should be used as guinea pigs, or you know, when the time is getting to the point, well, you know, give us everything that we need. I'll find a piece of paper if you want, you know, and then that we should be all. I'm a bit nervous here because I'm on the phone, but we should all be involved in this thing to help people, because you know, if Ricky would have wanted someone to help him or to use marijuana or any drug, he would have taken it, you know. So to help him out, I mean, so you know, I'm in complete favor. I mean, they legalize cigarettes and booze and so on and so on.
You know, one thing that's interesting, she commented upon the death and the person being 68 pounds. Well, the one thing I don't think we need scientific studies on is that marijuana is an appetite stimulant. I mean, anyone who just has to watch a Cheech and Chong movie for their scientific research would realize that that's the case. So, I mean, sometimes when the government says there's no evidence, they're really just ignoring the obvious, and it's unfortunate that someone could waste away to that weight when there was a substance that could stimulate their appetite.
Now, but Alan Rock did come forward to say that he was going to do some clinical trials.
No, he said they would look at it. He made no timelines, no budget, and no responsibility center. He announced that on March 3rd, the day before Bernard Bigrasse, the 28-year-old Bloc Québécois MP, introduced a motion in the House of Commons calling for Parliament to debate medical marijuana. And that debate is going into its 3rd debate, whatever they do. So that
he
was
circumvented that debate by saying we're going to go into
his
political
people,
trials.
whoever brief him, sometimes get it right. Now, what I've fired off a couple letters to Mr. Rock after that announcement, because I'm worried that if you get the wrong people doing the wrong studies, you get wrong outcomes. And I think the government needs to declare some kind of amnesty and get some growers to the table, people who know about cultivating marijuana, who have some experience in this field. They should be learning from them.
Right.
Not
What's your worry, that they're
them.
going to bring someone in who's going to make sure that they grow marijuana that has the least intoxicating effect from it?
It's actually a very complex plant. They have to do clinical trials. I mean, we know it works, but we don't understand how it works. But I can tell you this, because we found this out today. There's not going to be clinical trials in the near future.
No.
Is that what they said?
No. But this is what I asked. I said, have you secured a source? They need marijuana to do the trials.
That's why they went to NIDA.
They have no commitment from the American government. They have no commitment from the UK government, because they're both growing, and they have not looked for any Canadian botanists to do it. So how are they going to run a clinical trial? They can only use placebos. They have no marijuana.
So what did they say, though, when you were in court in answer to the concerns about whether he would be allowed to use marijuana and whether there was a process to allow that to happen?
They're working on it. They have a process. They're working on it. Just wait. Be patient. It's a terminal illness we're dealing with here. I think they have to move with greater dispatch.
6 officials prepared one one-page letter from Alan Rock to Alan Young that blew me out of the water on November 18th, when he announced his officials were examining my extraordinary request. How much money would that have cost? These are all suits. These are high-paid people. What kind of money waste is going on here? And they're doing this. You know, I think they hope I'll just croak and then it'll be finished for a while. But I'm not going to do that.
Good. When we come back, we're going to meet a dealer who offers hydroponic, organic, indoor, outdoor pot delivered by skateboard or rollerblade. We want to hear from you. Should we legalize medicinal pot? The phone lines are open at 1-800-510-JANE. We'll be right back.
is Jane Hawtin Live on WTN.
Upcoming shows on Jane Hawtin Live Tuesday. Biotech Bounty, how genetic engineering is altering our food. Monday, The Broad Squad. Tomorrow, star interviews and movie previews with Brian Linehan.
Call Jane at 1-800-510-JANE.
I mean, I think the first argument would be if a doctor says that it's going to be of benefit to the patient, then what's the difference between any other type of medication? So if you agree that if a doctor prescribes it, it's good for the patient, then we should pick up the tab.
Well, if it's going to treat us like any other medicine, then I don't see why not.
Well, it is still, an illicit substance, so I don't think the healthcare should fund the purchase of it.
Because it's a medicine. It alleviates the pain, it helps the patient, so why not?
Yeah, the government can help to some extent, or maybe your medical plan at work.
No, because it's cheap enough anyway, and I mean, it's cheap enough to buy it on the street, so if it's being made available, it's going to be even cheaper anyway.
More than 3/4 of Canadians are in favor of legalizing pot for medicinal use, but not everybody agrees on who should pay for it. That's part of what we're discussing tonight with our guest lawyer Alan Young and his client Jim Wakeford, who's a social activist who wants the federal government to supply him with quality marijuana to help him deal with AIDS. Joining us now is another of Alan's clients, Warren Hitzig, who is the founder of the Medical Marijuana Resource Center. Thanks for joining us.
My pleasure, thank you.
Now, so explain to me what you do.
Since the government won't provide Jim, as an example, with his marijuana, myself and a group of people have taken it upon ourselves to provide that medicine for them.
Right.
We provide not only marijuana, but we also provide marijuana products such as edibles, cooking oils, as well as tinctures, hopefully to alleviate some of their symptoms of their illness.
Right. And so is this is a business then?
Correct.
That you're running,
That's
right?
correct.
So people pay, it's not...
Yes, that's correct.
So people pay for these products, and where do you get them?
We have established growers in Ontario, throughout Ontario, who come and meet with myself or other distributors of the club, and we arrange there.
Right. And so what are the rules for someone who wants to use the resource center?
You have to be legitimately sick. You have to provide a letter of diagnosis. and we have to confirm the letter of diagnosis as well. And then once that's confirmed, you're a member. And you just have to prove to us as an entity that you are legitimately sick with a valid doctor's letter.
Right. So you have to have a note from the doctor to say that this is something that's going to benefit you.
And money.
And money. I mean, you do have to pay. Right?
Yes, we do have an overhead. I mean, I think the government should provide it for people such as Jim absolutely free because it's a necessity to them. But unfortunately, they're not, and we have an overhead to pay, so we have to charge something.
Right. And so, how are the prices comparable to the street?
They're much cheaper. I can't give you exact details because it is very confidential and it is strictly only for members only.
Right.
But it is lower than street value.
Right.
That's
but
important.
You objected to me calling him a dealer.
Well, that connotes that Warren's profiting from these activities. And the whole idea is to provide a supply to sick people. You have to pay cultivators. There are no wealthy benefactors supporting this movement.
Right.
So that's why people pay. But when you said dealer, I was just concerned that that made it seem like he would be profiting.
Right.
And it's a cost. You find out what it costs to buy a pound, and then you distribute the pound at cost to your patients.
And I wanted to comment on two things. Number one, having the medical marijuana resource, which is fairly new on the scene, available, has made my life easier in that it's available, it's labeled, I believe it's high quality, and I don't have to deal with dealers on the street.
You don't have to be out in a street corner trying to...
Exactly. But the other point that Warren raised that I think is really important, and I meant to get to it, is the use of marijuana in not everybody smokes, and not everybody's able to smoke. And I expect the time will come when I won't be able to smoke. And I'm going to turn to places like Warren's and people who know something about medicinal use of marijuana, how to cook with it, how to prepare oils and tinctures and the things Warren was talking about.
And is that what people use? Do they use it in a different form? How do they?
There are some people who, unfortunately, because of their specific ailment, they can't smoke or they can't eat. So we provide a tincture, which is alcohol-based with marijuana saturated in it, and then they ingest it.
And do they just, with a dropper, or do they put it in water?
The dropper or half a teaspoon.
Or tea.
For the British clinical trials, they're looking at two other delivery systems, because smoking is a dirty delivery system. The good one is the aerosol spray, and I hope they develop that. And then they're also looking at suppositories, which I'm not sure too many people will be interested in.
Okay. But how many times have you been busted?
Never. I've never been in court once. Actually, today was my first day when I went to attend Jim's case.
Right. And so how long have you been operating?
Almost 2 years now, approximately 2 years.
So what's happening there? Are people looking the other way? I mean, are the cops
so.
aware of what you're doing? Or do you know?
I'm not sure, and I hope the situation remains as is, but I will tell you that March 17th, they arrested in Ottawa a cultivator who is known to the government to be supplying to AIDS patients. So Warren does stand in jeopardy, and I hope that he doesn't have to deal with that ordeal, but we're prepared for that contingency.
Mm. And so how do you feel about that part of it? I mean, it's not just you, right? You have a team that works to do this?
Definitely. It's part of the risk, and I think that we're all mature enough that we're able to handle the responsibilities and deal with whatever comes. When it comes to thinking about, upcoming bust, it's the last thing in my mind, because I have patients, in essence, who need their medicine, and that's the most important thing, is to make sure that it's clean, it's safe, and it's high quality, exactly what Jim's asking for.
Okay. Let's talk to Lorenzo, who's calling from Bolton. Hi, Lorenzo.
Hi, how are you?
Good, thank you. Have any problem with any of this?
Yeah, I want to make a few points about it. First of all, I have 3 kids, 2 teenagers, and I believe that if it is legalized, even in that sense, I think kids will probably feel that it's okay to do it, and it makes it a little easier access for the teenage kids.
Mm-hmm.
Also, I wanted to make a point the fact that they made a comment about how long it's taken, the amount of time that it's taken for the politicians to look at it.
Yep.
Well, look at the cancer. They have proven that there is cancer medication that could actually cure, and it's still not out there. People are dying. So he's not the only fella. Jim's not the only fella out there. There's people that need other medications much worse than he does. They're actually dying, and there is proof of this, of this medication, and it isn't passed. There's a lot of red tape. It takes a long time.
Okay, so Lorenzo's talking about conspiracy theories here, I guess, about cancer drugs being withheld from the public.
Well, let me just say this about kids, Lorenzo. If you're concerned about your children, educate them, talk to them. Valium, Prozac, these are legal substances, and you can tell your children, they shouldn't be taking these, and I don't think because they're accessible by prescription they think it's okay. Parents got to start taking responsibility.
It's a little bit different though, because as we talked earlier, marijuana can be grown in the backyard, and if it was approved for medicinal use...
How is a teenager going to grow marijuana in their parents' backyard without the parents knowing and taking some action? Parents want the government to take care of this problem. It's for parents to take care of their children and not to have the government say, well, we can't help sick people because we're worried about the message given to children. That's a parental responsibility.
But that's part of what's coming into all of this, isn't it? I mean, that's certainly the message from the United States. That's
they always use the kids. Save the kids, save the kids. This is not about children. This is about adults and children probably needing medicine. And they shouldn't keep raising the specter of our children being corrupted by drugs as the excuse not to provide medicine. So I'm sorry, but if you have a problem with that, you should be speaking to your children and not looking to the government to prevent Jim from medicating himself.
And you should also make sure that if you have one, that your gun cabinet is locked. And if you have a liquor cabinet, you should probably make sure that your children don't have access to it. And if you're still a smoker, like me, you probably shouldn't do it in front of them. But I'm sure you do all those things anyway.
Well, maybe he doesn't. We'll be right back to take more of your calls and your email. The phone lines are open at 1-800-510-JANE. Is it time for Medicare to cover marijuana?
Our phone lines are open now. Call Jane at 1-800-510-JANE. Call Jane at 1-800-510-JANE.
Medicinal pot or not? That's what we're talking about tonight. Our guest, our lawyer, Alan Young, Jim Wakeford, who is a social activist and AIDS patient who wants the government to pay for his pot, and Warren Hitzig, who is the founder of the Medical Marijuana Resource Center. Let's go to the phone lines and talk to Kathy, who's calling from Prince George. Hi, Kathy.
Hi.
Hi. Are you a supporter of medicinal marijuana?
Yes, I am. I use it myself.
What for?
I have a very rare neurological disease.
Uh-huh.
One, basically, the doctors have put me on pretty much every drug out there for both supposed to help me and supposedly to control the pain.
Right.
And we have a couple issues here. One is, your last caller was concerned about children.
Yep.
I have in my home, I have 2 children, and this medical use of it, yes, I am in support that, no, you don't smoke it around your children, you don't use it around your children, you keep it locked up.
Right.
But my kids are 2 years ago, I was in a wheelchair. I wasn't even a mother to my own children.
Right.
So,
Because you were too ill?
Yeah, I was too ill. They had me so zapped out on all the pills. I mean, it's okay to give a patient Demerol. It's okay to give them Hawtin. It's
right.
Okay to give them the Valium and all the other stuff.
And so, Kathy, what's life like for you if you use marijuana?
Well, now that I use it, I'm a mother to my children.
But it is a double-edged sword, because I know I've talked to other people who have kids who use medicinal marijuana because they're also fearful of the busts. And there's lots of people who have been busted, and what that means to their kids when, mom or dad is getting arrested.
An American man got busted, got 92 years in jail in some state in the United States.
Oklahoma.
And his wife had to plea bargain and turn against him because somebody had to raise the children. It's
the new issue that I'm dealing with recently, and it's very sad, is Children's Aid is intervening with medical users and taking kids away or not allowing visitation because of marijuana in the house. And I try to write to them and send doctor's notes, and they don't understand. That's why the government has to do something, because I guess legitimately they have to do that because it is an illegal act until the government does something. Right. And that's very sad, to take kids away.
Joining us now by phone from Vancouver is Hillary Black, that I guess you all know. She runs the Compassion Club, which is North America's oldest and biggest medicinal marijuana club. Hi, Hillary.
Hi, Jane. Thanks for having me.
Thanks for being with us. We've been talking to Warren about how it works. It sounds like it's similar, the way that your organization works, only I think maybe yours is larger?
Yeah, I think we've been running for about 2 years now, and we have, I think we registered the 724th member today.
Wow.
That's amazing. Congratulations.
Yeah. Thanks.
And so
and about 80% of those people have written recommendations and prescriptions from their doctors. The other 20% are people that have conditions that undeniably cannabis dramatically improves the quality of their life, and it would be extremely uncompassionate for us not to register them regardless of what their physician will or will not write. Most of the doctors that won't write a prescription, it's not because they think that the herb is going to be bad for their patient, but because they're worried about the legal implications.
Yeah. Now, are they protected at all? I mean, the idea of Warren and also Hillary getting these notes from people to have it, it's not going to protect them if they're busted.
There are certain legal issues that I would raise, defenses of medical necessity. Actually, that's what Morgentaler did every time he performed an illegal abortion. It'd be the same argument. Whether it would be successful in court, I'm really not sure.
But at least it's something, right?
Oh yeah, there's something to fight about, and we would fight. And I know that Warren's a fighter, and Jim's a fighter, and Hillary's a fighter. We have good people.
Yeah. So what's a delivery system though, Hillary? How do you get this stuff to people?
We have a center, and most of the members come and pick it up. We encourage people to come out of their homes and come down to our place if they're physically able to get out, because there's a lot of social support that happens. There's many people that are very isolated within their sickness in their lives. And they come down to the Compassion Club, and it's a place where they can, joke around with other folks that are in a similar situation with them. And we actually have a smoking lounge in our place where they can sit and have a cup of tea and have a smoke. And it was important to us to create an environment where people could obtain and use cannabis without the fear and shame of breaking the law. So it's been really important to us to create that environment for people to come down into. And then,
But what's weird about all of this is it's like it's not even sort of underground anymore. I mean, this is pretty out in the open. If the Compassion Club has a smoking room for people.
In Vancouver, it's fairly open. I don't think attitudes in law enforcement in Toronto are quite the same, and I think Warren has to be more circumspect. But I will say I was out in February to see Hillary and the establishment. Very impressed with what she's done and the establishment. And not only do you have the smoking room, you have yoga classes and a herbalist. It's a whole health center now.
And massage and all kinds of things going on there.
It's amazing down there. Absolutely. It's just beautiful. It's exactly what should be done for people who need compassionate medical marijuana. It's just, it's a prime example.
It requires a compassionate landlord, hey, Warren?
Yeah, completely. Yeah.
I guess you, faced eviction, and Hillary, you've faced eviction how many times?
Oh, 1, 2, 3 times. This is our 4th time lucky. We found a wonderful man who's given us an incredible space for a very fair price.
But that's the tough one, isn't
Yeah,
it?
so we have the ability to, create the Compassion Club side and also the Wellness Center where we have all of the different therapy rooms and all the extra services. But it's not possible without somebody to give you a chance and give you the space to do it in.
I think your viewers, though, should know that it is highly illegal, successful as it is, and thank God it is, but these clubs operate under 2 daily threats. Threat of police interference and threat from gangsters because there's no protection in the community.
Come on, don't give them any ideas, huh?
Thanks for being with us, Hillary.
No problem.
Thanks very much. Let's talk to Diana, who's calling from Edmonton. Hi, Diana.
Hi.
Hi. Do you support this fight that Jim's waging here?
Yes, I do. I use medicinal marijuana myself. I have multiple sclerosis. I was dead set against any form of drugs until trying medical marijuana, being a Christian. But I had found that during a bad spell of what is known as spasticity that a lot of MS people suffer from, and that is where your legs just will not go. They just, we cannot walk. So this is where a lot of us spend time in the wheelchair. But during a particular bout of spasticity, I thought, okay, I'm going to try. And I had a smoke, and I couldn't believe it. Within minutes, I was walking almost normal again. So yes, I agree that it should be legalized for medicinal purposes, but I'd like to sort of share a scenario of how I think that would look to me, and that would be that the government could legalize marijuana for medicinal use, but only it could only be manufactured by, say, a drug company, and only made
they're groaning, Diana. They're groaning. They're groaning at that part of it.
Oh, really?
Skyrocket. You'll have to win the lottery.
By prescription
okay,
only.
but that you don't want that, right?
Keep those drug merchants out of this. The pharmaceuticals have too much power, too much control, and too much money, and they've got the government in their pockets already. They should keep their hands off marijuana.
Well, then how do you get the quality control?
Growers. License and regulate growers. And support buyers clubs.
I'm not as opposed as Jim is to pharmaceutical involvement, but unfortunately it could skew the whole project. They have different interests in mind.
Okay, thank you all for joining us. Thank you very much. I'll be right back.
This is Jane Hawtin Live on WTN.
For more information on the case for medical marijuana, you can visit Jim Wakeford's website, which is www.interlog.com/Wakeford. And what I just wanted to mention was when they hear from the judge, they have no idea which way he's going to rule, but the judge could rule that Jim should be exempted from the law, which means that he could legally use marijuana. That would be the first time that that's happened federally. Or he could say the government's working on it and you just have to wait till the government decides that you can use marijuana medically, legally. On Tuesday, bug-resistant potatoes, strawberries that you can grow in the cold, bigger, redder, juicier tomatoes. Scientists have been working hard at creating the perfect food crop, but are they endangering the health of the people who eat them? Some say they're genetic breakthroughs, others say it's an unnatural harvest. Tuesday on the show, Biotech Bounty, how genetic engineering is altering our food. On the next show, Sean Connery, Catherine Zeta-Jones, Michelle Pfeiffer, Callista Flockhart, Kevin Kline. Brian talks to the stars in a way that no one else can.
They're all going to think that I'm crying now because you have me in hysterics.
No, she's not crying. It's not Stepmom. It's Notting Hill.
It's not. It is.
It is indeed Notting Hill.
Oh.
Isn't life full circle? That
you are cracking me out today.
Will you pull yourself together?
Yes, I'm pulled.
We're working.
Okay.
Fine.
Go, baby.
Put your picture up at immigration in Toronto. You'll never get back in.
On the next show, we'll have Brian Linehan's interviews with the stars and preview some of the hottest new movies that are about to hit the theaters. Hope you can be with us. I'm Jane Hawtin.
We welcome your ideas and comments. Please write us at Jane Hawtin Live, Box 115, 275 King Street East, Toronto, Ontario, M5A 1K2.